nanoparticles, and these nanoparticles have the ability to hit the target rather than the human body. I mean, whatever, the nephron, hepato, whatever, okay? It is not toxic. I mean, liposomal amphotericin nowadays is available and is playing an important role to treat many sophisticated and refractory cases of fungal diseases. Now, a recent small retrospective study, combination therapy, they found that liposomal amphotericin B plus caspofungin is another drug. Combination of these two drugs give good results of many refractory cases, and particularly in mucormycosis. Based on animal model, this is important also. Based on animal model data, differoxirox. I spoke about the differoxamine. You remember I said it's iron chelating agent, but it's at the same time it is enhance the growth of mucormycosis as a disease. Okay, but there is an iron chelating agent, another one, which is the differoxirox. This is right. In contrary to differoxamine, this will inhibit the growth or kill the members of mucorales. Contrary to the previous drug. This is important point, okay? And there is another model for treatment, which is the hyperbaric oxygen treatment, may be beneficial, okay? You know, those with the need whatever pulmonary manifestations, whatever, they need hyperbaric oxygen treatment. Also cytokines. Cytokines also may be important. Cytokines also, such as interferon gamma or granulocyte monocyte colony stimulating factor, also play an important role for the treatment of mucormycosis, whatever the size, okay, of the infection. Now, in case of COVID-19 patients suffering from the fungal infection typically have symptoms of stuffy, bleeding nose. The symptoms of those patients suffering from what? I mean, COVID-19 with the mucormycosis. They suffering from stuffy, bleeding nose, swelling and pain of the eye, dropping of the eyelid, blurred vision, and finally loss of the vision. This is in addition, of course, black patches or spots surrounding the affected nose. Now, the doctors say, this is according to a speech of one of physician, Indian physician, he said most of their patients arrive, arrive late. Because they arrive late, okay, they are already lost their vision. If they come early, of course, maybe they control the disease. Okay, this one of the complications, and they, of course, the doctor have to be surgically remove the eye and to inoculate the eye and to stop the infection from reaching the brain, metastasize easily, as I mentioned. In some cases, doctors in India say patients have lost their vision in both eyes, not just one eye, some of them both eyes may be lost, okay? And in rare cases, doctors have to surgically remove even the jaw, even the it's reached the bones, okay? Even the jawbone in order to stop the disease from spreading. An antifungal intravenous injection, the cost of this, according to the speech of this doctor, approximately $48 a dose, and has to be administered every day for up to 8 weeks. 8 weeks, the long period of time, is only the drug effective against the disease. One way to stall the possibility of the fungal infection was to make sure that COVID-19 patients, both in treatment and after recovery, were being administered the right dose and duration of steroid. This is important. The steroid very important role to prevent the disease. I said in the beginning, COVID-19, those patients with COVID-19, either diabetic patients or they undergo high dose of corticosteroids. Okay, this is very important point of view should be put in mind. Now, I will overcome this because it's so in Iraq here. This is in Iraq, according to updated information, which is on Friday, 4 okay, June 2021, which is up-to-date or updated report. Okay, the Iraqi Ministry of Health reported on Tuesday the first 5 cases of mucormycosis or black fungi, and the first related death in a southern province, the Kartaman. The man's initial death documented stated that he died from a fungus in his eye, infection of her eye in the beginning, okay? But a specialist doctor examined the case and then discovered by chance the disease, okay? The man died due to the infection and by this agent. Local health authorities in Kurdistan region's province of Suleymaniya on Tuesday announced the first known death from the condition known as black fungi of a man in his 70s who was suffering from the diabetes. That means he was diabetic and he died due to COVID-19 in Suleymaniya. Okay? This is, I want just, because according to the deficiency, if you remember, iron chelating agent, I think this needs further study. Maybe, and according to the animal model, I think this as prophylaxis to prevent this disease, particularly COVID-19, maybe the iron chelating agent can be used as prophylactic agent, but this needs further studies. Okay, I think the dermatologists maybe put this in their mind in future to see if it's effective, according, of course, to the animal model. Animal model is success, 100% the percentage of the curance, okay, by this agent. But in human, till now, it's not approved, okay? It needs further study to see if it is effective or not. But to prevent mucormycosis as prophylaxis, used before COVID-19, posaconazole, it can be used as prophylactic agent. Posaconazole, prophylactic agent to prevent the complication of mucormycosis in diabetic patients whoever. This article not in COVID-19. This is for in general, okay? But I spoke about the iron chelating agent for the COVID-19 particularly. It needs further studies. And in conclusion, increase in mucormycosis in India context appears to be an unholy intersection of trinity of diabetes, high prevalence genetically, rampant use of corticosteroids, increased blood sugar, and opportunistic fungal infection, and COVID-19 cytokine storms, lymphopenia, endothelial damage. That means diabetic, corticosteroids, and the cytokine storm. These are the trinity of the developing or overcome of mucormycosis in those entities of patients. All efforts should be made to maintain optimal hyperglycemia. This article very important. All efforts should be made to maintain optimal hyperglycemia, and only judicially evidence-based use of corticosteroids in patients with COVID-19 recommended in order to reduce the burden of fatal mucormycosis. That means the patient should be followed after even recovery, diabetic patient, after recovery from COVID-19, because the fluctuation in the blood sugar play an important role to flaring the disease. Thank you very much. I hope to be enjoyable. I'm not bothering. Thank you very much.